diseases and specialties, and it's a huge thing. So it's hard for us to touch on everything, but you know, I think that you've given good answers today on midwifery, and I appreciate getting a sense of where it's going. There is a sense, I think, of urgency for the women that are not being able to get the services. And I think just before we close it off, it's worth mentioning, and I know the minister gave a nod to their professionalism, which I think is very true, that they're well trained, but at the same time, they give a different kind of care than you would get from an obstetrician or your family doctor, because they will not only be with you at the birth, they give a lot of prenatal care and they give a lot of postnatal care. And ultimately, your long-term, you know, progress and outcome is probably better because you've got somebody who has the time and sees it as part of their professional practice to give that additional support that I think any mother can use. You know, and I think any mother, even when you've had the advantage of lots of education and so on, it's a whole new realm when you suddenly have children, a new baby at home, and having somebody that can advise you on you know, things to look for and how to care for your child is really important too, and how to care for yourself. So I think that there's a demand and a need, and I'm glad to see that we're working on the culture, because what it just is, it's not the first time we've had new professionals entering into that medical realm, and it's important that we make space for those different professionals. In the same vein, I'd like to ask the minister if there's been any discussion around the introduction of physician assistants. And this, again, another category of professional. They're used in the military. I believe they actually call them physician assistants. So they're used in the field and to provide medical care for military families and people. But when people who've served in that role come out of the military, there isn't a similar title or role in at least here in Nova Scotia. I do know they exist in New Brunswick, and I'm sure in other provinces, maybe not all of them. And I think it's the context in which I ask this is really an area I'd like us to explore a bit today, and that is the international medical grads and opportunities for us to integrate people who have a lot of high-level experience and training and are facing a lot of obstacles to get into the system. So just if you could see if that's something being considered or where you're at.
The Honourable Minister of Health and Wellness.
Thank you. There is a provision under the Medical Act that allows for physician's assistants to work within our system. Saying that, we know that we want to explore all the opportunities. I've said it over and over again that, you know, for us to move forward in healthcare, we need to maximize the healthcare providers we have in the system now, utilize them to the best of their ability, to the full scope of their practice. I think we've showed a commitment to do that, where we're utilizing other healthcare professionals in different environments. Paramedicine is a key example over the last number of years of how we've expanded that. There are limitations over the last couple of years in regards to our financing of the province. That's why it's important to get back to balance, so that as we move forward, we can look at all opportunities. And I have to say, personally, I'm very supportive of the concept of physician assistants. I know people who work in that field in the military, and they're very supportive from the physicians in the military and the work they do and the work they do overseas or wherever our military are stationed. We've worked hard over the last couple of years to increase nurse practitioners first. So I think we have a duty before we start bringing in new professions to ensure that we're supporting the ones we have. So utilizing nurse practitioners, for example, I've yelled about it on the other side of the floor over here with the previous government about the lack of utilizing nurse practitioners to their full potential. I mean, we had nurse practitioners trained in the province who couldn't work as a nurse practitioner. And I always gave the example of the Cobequid Centre. When nurse practitioners were really starting to get recognized and they were starting to do some training on it, we had a nurse at the Cobequid Centre who worked in the emergency department, went and did the training, and very difficult to do. I mean, here you were working full time. I know she had a family, went back to school and became an MP. And when she went back to work at the Cobequid Centre, and I don't believe the deputy was there at the time, or I would have wagged my finger at him, he wasn't there. The rules stated that she could not work, and it was a lady, couldn't work as a nurse practitioner because the way the system was set up, they had to work directly under a usually, I think it was general practitioner. And we had emergency room docs that were there, and they were coming and going, and there was nobody to oversee her in her role, which in my mind was a little bit ridiculous because she's trained, she has a scope of practice, she's licensed under the college, she should be allowed to do the job she's trained to do. And I say that because I come from a profession that we have a scope of practice, we have protocols in place as paramedics, and it doesn't matter where you're at in the province. It didn't matter if you were on duty or not on duty. If you came across someone that was ill, I could perform the duties as trained as a paramedic. So if someone wasn't breathing, I could intubate them or give them an IV. Well, if I had the IV, I didn't carry IVs around with me. But if, say, an ambulance came that had lower trained, there are some people that carry the bags around. But I was never one that had those. I carried a medical kit, but never the IVs and stuff. I left that for when I was at work. But if an ambulance came to a scene that had maybe just primary care paramedics on it, I could, in my civilian clothes, jump in the ambulance and go because I was trained in the province. I had a license to do it. And I couldn't understand why that wasn't offered to nurse practitioners. We've changed that, and now we see nurse practitioners, some who are working. I look at the young nurse practitioner who's in Hantsport, for example. There have been some issues over the last couple of years with keeping the doctor there. Doctor's leaving, the nurse practitioner was left. The nurse practitioner was running the clinic for months on end, seeing thousands of patients or supporting thousands of patients. So we've come a long way. So I think before we say, yeah, let's move ahead right away with the physician's assistants, we ensure that we're supporting nurse practitioners, we're supporting paramedics, for example, but very supportive of the physician's assistants. I think in the future we have a lot of opportunity where we can explore and even work with the federal government, the military, to see if maybe they can work in both fields, in both sectors, in the military, and then maybe support our system in Capitol Health or wherever they're stationed. I know we've been doing some work on the nurses and some of the doctors that are working at the QE2, for example, or are military trained or are in the military. So I see in the future the possibility, but right now I think because of the limited resources, we need to make sure that the nurse practitioners and nurses and paramedics are supported in expanded use of their skills. But I foresee that it's an area that I would like to explore in the future and potentially the benefits of utilizing physician's assistants. There's another one too, I know recently, I don't want to take up all your time, is anesthesiologist technicians, I think they're called. They're big in the U.S. Where they support those physicians in the OR and lessen the burden on an individual physician. So there's many options. I think we can continue to look around, especially to the south of us, on the possibility of utilizing different professions.
The Honourable Member for Halifax, Clayton Park.
Thank you very much. I'd like to continue on with the idea or the subject of the international medical grads. And I know the deputy was here at Public Accounts, would be about 2 years ago almost, year and a half ago, in the spring, I think it was, so 2 years ago, when we had the College of Physicians and Surgeons here. We had somebody who was working or representing ISIS, the Immigrant Settlement Association, and talking about their works to collaborate, and I think they have a round table of people from different perspectives who are trying to find that avenue to integrate the foreign-trained doctors. And it was an issue. It's a big enough issue that it was here at Public Accounts, because I can speak from my riding that we have a lot of newcomers in Clayton Park. I know we do in HRM in general, so maybe there's other members that have talked to doctors. I'm sure there are. I get a fair number, and I would say in the question of immigration and immigrants that come to visit me, the majority of them are doctors, sometimes pharmacists. I've had a number of them come in, but it's doctors who are frightened, discouraged, overwhelmed by what they need to do to return to their practice, if at all, in Nova Scotia. And I really do get worried that there are other provinces that are opening paths and avenues for them, and we are not doing it. And I just hate to think that there's other places that are making it, just smoothing the way and making it easier. And I have a doctor I'm working with right now, the minister might be interested to know, he's an internist or an internal medicine doctor. I understand we have a shortage of internal medicine, and yet he's trained in England, actually. And I've spoken to the College of Physicians, to their registrar about this individual. But, you know, here comes an individual with European training, with his residency in England and lots of training in England, coming here, and we're not seeing him as a professional or specialist, and we're not making room for them. And as the minister knows, one of the big worries is that there's something like 5 years that a doctor is allowed to be out of practice before they are really not eligible to re-enter, to begin practice again. So the clock is ticking, and particularly if they come here without the language to begin with. If they arrive in Nova Scotia and have to learn English and then learn the professional language, get familiar with the culture, they can be a number of years here before they're able to start taking the tests that we offer and the avenues that we offer. So it's a really big issue, and it's a loss of human potential and capital that we have here that we're you know, I don't think we should be ever, you know, allowing that to happen. I think as much as possible, we should be paving the way and working with the college and any other professional groups to try and make way for these newcomers that have been trained in other countries. And I'm speaking particularly the immigrants. I know it also includes Canadian grads. I understand there's something like 1,000, I've heard the term 1,000, can't be Nova Scotians, but there's a lot of Canadians studying overseas in schools in the Caribbean and Europe. And we need ways to bring them back home too. So my question to the minister, to be more specific, would be, could he comment on efforts to integrate international medical doctors? Could you tell me how many have taken the CAP last year? I realize that's family doctors and not specialists, but could you give us an idea of the funds allocated towards the CAP? And maybe we can just start with that, and I might have a few more questions to go beyond that.
The Honourable Minister of Health and Wellness.
Thank you. We realize the importance of recruitment, retention of physicians, and giving every opportunity for those foreign-trained physicians to come to Nova Scotia, hopefully get some of the additional training they may need, but more importantly, stay in Nova Scotia. And that's why it's so important to have you know, other departments working to ensure that we create an environment that's welcoming to new immigrants to the province, especially those who might have the skill sets as a physician. So we do have the CAP program, which I know recently I had been down to Yarmouth, and they've been very successful in utilizing a number of immigrants to gain access to the healthcare delivery system here in Nova Scotia through the CAP program. So the budget this year for CAP program is $5.5 million roughly, and that is an increase of $929,000, so almost $1 million increase due to the increase in physicians and program costs. So we have 24 right now in the province under the CAP program. We're continuing to work to see if we can get more physicians into that program. Of course, you need the support of local physicians to sponsor them, and really the community to rally behind them. And the community really does. You know, like Yarmouth, for example, have been very good at receiving international students and making them feel welcome and really welcoming to that part of the province. So we have discussed this on a more national scale in our FPT meetings and our federal, provincial, territorial meetings as ministers of health. This is an area we've talked about for a number of years now, trying to get a grasp on physician resources across the country, because for far too long we've all worked in our own little silos to try to recruit physicians, and we realize we do, even though we're still competing, we still want to ensure that Canadians have access to the doctors they need. We know the number of doctors have decreased over the last decade or so, but our one of the things we have done is there's been a committee created of deputy ministers of health and deans of medicine, in which our deputy and our dean of Dalhousie both sit on. It's chaired by Manitoba, and their initiative is just to look at physicians' resources, and this was really driven by I wish I could say me, but it wasn't me. It was driven by the deputies of each province, because they know the ministers kept talking about it. They knew it was important for each jurisdiction, so that committee meets, our deputy and the dean at Dow meet to try to figure out how do we move forward, how do we ensure that we give anybody an opportunity to at least explore the possibility of coming to Canada to practice medicine. There are challenges. It was interesting you mentioned physicians could be off for about 5 years before they need to, before they lose their license. Paramedics, it's only 3 years, so I don't know why there's such a short distance timeline for them, but yeah, there is that. But one of the things that is of concern, and really what jurisdictions need to make happen is ensure that the training that these individuals go through is comparable of the training that's required and that is delivered here in Canada. And you know, we hear, and I hear from many, mostly not only in the immigrant population, but from Nova Scotians who go to foreign schools for training. One of the more prominent ones, I think, for our region is SABA down in the Caribbean. And I've had colleagues who are paramedics who are down there for some reason or another, because of wait lists or were unable to get access to Dalhousie. And I think I said this to one of my other answers from one of the other members is, you know, SABA is a very appealing area to go to. It's down in the Caribbean, but even though it's down in the Caribbean, I don't think it's any walk in the park or on the beach to go and take your medical school there. But there is a requirement, and students who go there need to understand, if a Nova Scotian student is deciding to go there, they need to understand that it's not just as simple as coming back to Nova Scotia and you can start practicing. There are hoops that you need to jump through to get certified for some of the residency programs here, for example, or even afterwards get into Nova Scotia and Canada as a whole. And they're limited. The residency programs and seats are limited across the country. It's a national program. So when you decide what area you're going to practice in, you apply for your residency program, and then there's options for you. You can end up in BC, you could end up in Newfoundland, you could end up in Halifax. So there are requirements for those individuals who go to SABA, for example, that they need to be mindful of, trying to make sure that they fill those gaps. And often I get the call, I've gotten them in opposition, I've gotten them in as minister, that, oh, well, you know, I need to go back in a month and I can't get into any programs here because I don't have this. So I need to emphasize to all Nova Scotians, if they're deciding to do that and to leave our jurisdiction to go get trained, that you know the ramifications and any additional training you need to have. So our deputies, our Dean of Medicines are working on a national approach to see how we support physician services and how we try to ensure that we can get foreign-trained students or foreign-trained doctors, not even just students, but doctors who are medically trained in other countries, because we know Canada is very appealing to people. They want to come here. And you always hear about the stories of immigrants who come to Canada, who come from a country that they were engineers, they were doctors, they were lawyers, and they're not able to work in those capacities here in the country. And it's a shame but they're so glad to be here. Some of them drive cabs. I think all members take cabs, and I am always intrigued on where these individuals come from, what their lifestyle is, or what they did, their profession. And I've ran into some who were physicians and who were lawyers and engineers. But they're so glad to just be here and work. So we need to try to work on a more national level because of the entry requirements from the colleges, for example, or the College of Physicians and Surgeons, so that there's opportunities for individuals to come to Nova Scotia to set up a practice or even get the support from other physicians. So that's where we're at, the picture on that. I think we're moving in the right direction. One of the things we are doing is we're not protecting our own. We're having an open dialogue nationally, which hasn't happened for many years. People were very reluctant to share some of the successes we've had in different jurisdictions because you didn't want them to start taking your resources. So I think we're all on the same page nationally now, the Deputy Ministers, the Dean of Medicines, and hopefully there'll be some good things come out of the committee as they move forward.
The honourable member for Halifax, Clayton Park.
Thank you. And Madam Chair, I have a few questions for the Minister around the resources that we're going to dedicate to this. Again, I really appreciate the discussion and knowing that our heart's in the right place, let's put it that way, that we all want to see a system that can integrate people with their skills. But my understanding, if we can look at just a couple of the avenues that a doctor has, one avenue is if you're a family doctor, you write your exams and so on, and then you have to pass that CAP OSCE test, which is I think OSCE is the term you use, where you have simulated patients and you go through a simulated day in a clinic so that you see a whole bunch of different patients presenting with different symptoms, and you are being watched by a doctor or somebody who can measure your response to each of these cases. And the pass rate is very, very low in that test. And perhaps the Minister might know what the most recent one is, but 2 years ago, I believe it was 36 people sat that or went through the OSCE, 6 were successful. And I would really like to know if you have any updated information. I think the limitation here might be that it's conducted by the College of Physicians, but I believe that the province helps in some way to fund that, although the immigrants pay a lot of money. They pay $6,000, that's where it was a few years ago, each to sit that exam with a pass rate of 20% if they're lucky. 6 out of 36 was the last that I had heard. And so I'm wondering if you can say, my real concerns, we've got this CAP that I'd like to know if you know the numbers on. How many are sitting it? Do we provide any funds towards it? And then the amount of money you told me about, the $5.5 million, which I'm really glad to see it's gone up. That might be largely because of doctors' fees, but it's up almost $1 million, so it's probably above any increase in their pay. So it must be an expansion as well. You said there are 24 doctors now working under the CAP, and that's where we take them in, I guess, under our public health system and begin to pay them, and we pay doctors as well who are supervising them. So 24 at the moment, and that would be over a number of years. That would be the people who were successful in writing those exams and doing well in the OSCE exam as well. So I'm wondering if there's any plan to expand the number of positions that we would offer each year, because I strongly believe, although I have no proof to this, but I strongly believe there's a correlation between the number of people who pass the OSCE, if we can call it a pass in that exam, and the number of places that are available each year that the province is funding. I think the College of Physicians is reluctant to give a pass to more people than they can accommodate in the system. And I think that it may be that it's not so much or not entirely those that are not qualified, but they just pick the best 6 or the best 7 based on the amount of money that the province of Nova Scotia is putting in. So I'd just like to know whether that we are going to expand the number of places the province would pay for, because I think we would see a corresponding increase in the number that are available to take those placements around the province. And I want to see a way that we can expand the number of opportunities, because we literally have over 100 doctors. I know it might be 200 or 300 that ISIS is aware of, that work with ISIS and with the immigrants, and yet we only have something like 2 opportunities, 2 places to get into third-year med school as a bridging program. We have only a few that get through the OSCE exam. We have a few lucky people who might get on with a DHA. So by and large, a handful of the foreign-trained doctors find an avenue, and the vast majority don't, and they go to Newfoundland, where they seem to have a better system. So could we just get a little bit more on the CAP and the number of positions we fund that might help to increase the number that are getting through the OSCEs?
The Honourable Minister of Health and Wellness.
Thank you. And for the members' information, we do fund the positions at Dow for the opportunity for them. One of few jurisdictions across the country. When it comes to the CAP program, of course, the number moves as people try to pass the exam. Over the last number of years, we've had as high as 56 individuals in it. Currently, we have the 24. And the increase that I talked about, almost $1 million, only about 100,000, 109,000 of that has gone to the increase in the wages. 820 of that has gone to the increase in the program itself. So majority of it is to go towards increasing those numbers. So out of the 36 registered to write the exam, 8 passed, and all 8 are working now in rural Nova Scotia. And I think it's important that we have those exams in place. The last thing I would want to see in the province would be any changes to allow a variance of allowing people who might not meet the standard in practicing in the province. We're very concerned that they need to have the competency. That's why we have the program set up the way we do. And it'd be expensive. There's not a lot of opportunity for us to support an individual to come in and try to take the additional training. We find it extremely difficult to sustain what we're doing now. So if money was no object, yeah, maybe we could invest more in those doctors who come over, who are trained in foreign schools. But right now, what we need to ensure is that we have a process in place that at least allows them to register for the exam. Hopefully through the CAP program, they get support of local physicians who mentor the individual and hopefully prepare them to be able to pass that exam. So I understand where the member is going and some of the concerns. We have them also, but we provide over $200,000 to the college each year for the administration of the exam. So we're supportive of the exam. We're ensuring that we're supportive of ensuring there's opportunities for people to write the exam. Would I like to see more of those individuals, the 36 who wrote this year, be more successful? Yes. My hope that all 36 could pass and all 36 would be working in the province in mostly rural communities. So there is stringent requirements to ensure that people are competent within the healthcare field. It's the same for any profession. I know as a paramedic, after I got, maybe it was before, but after I got accepted into school, the pass mark was 75. And I thought, oh, 75, you got to make sure you do really well. But I think it was for a reason. You know, who wants to have a professional, especially a healthcare professional, only know 50% of what they were taught and deliver service? I don't know what it's like in other professions. They can't tell who I'm looking at. But I know there's strong testing that is required for anybody who's entering the healthcare field. 30% of the physicians in Nova Scotia are internationally medical graduates, which is a high percentage, I think, overall for a small jurisdiction. So I think we've shown we've done well at trying to get foreign trained doctors here to the province. As I said, 30% of the doctors we currently have in the province have been trained outside Canada. So it is a high number, and we're going to continue to try to fill the gaps. And you know, as a minister, as an MLA, I'll continue to try to help any of my constituents who find themselves in trying to get access, and I'm more than happy to help member opposite if there are people who are contacting her to see what we can help to see who they can get in touch to make sure that they have all the opportunities and the best opportunity to pass the exam and then get licensed here in the province.
Member for Halifax, Clayton Park.
Thank you, Mr. Chair. I appreciate that offer that you've just made about perhaps allowing them to get in touch with your office. As I said, I have somebody who is a specialist who's looking for access into our clinical practice here. And I did call the College of Physicians and had a good discussion with their registrar. But I think that there might be avenues. And I really feel that even though we tried to clarify it through the Fair Access to Regulated Professions Act, or it has a name like that, the minister will recall when we were in opposition, he was also in opposition, I had actually introduced a bill that took one tiny part of the Immigration Act in Ontario. When they did a very big Immigration Act, they had one on making the regulated professions, requiring them to map out their process for immigrants. How do you go about getting licensure in all these various professions? And I brought that as a private member's bill here, and I can tell you that just those few years ago, it would have been about 2006, the minister may be surprised to know that even in 2006, there was resistance from the College of Physicians and Surgeons at that time to be required to do that, to make their process clear and transparent. Because what I heard at that time was from all of the different medical professions, they didn't know what was required, and they'd jump over one hurdle and another and write this exam and that exam, and then they'd be told, oh yes, but now you're back over here, you've got to do these 10 things. And they could never see the whole process, and they didn't know where the end was. And the professions have now done that. That act was, my act wasn't passed, but another one was brought in that included trades as well, and has really addressed that whole area. And I think it's better in terms of at least understanding what's required. So we're one step ahead there, but I mentioned the fact that when I brought in the private member's bill, even though as all of us know, when you're in opposition, chances are your private member's bill isn't going very far, I was contacted and I was told that the college had the full jurisdiction and that they thought they were doing fine. And I felt there was real resistance to change. And I think it behooves us to accept that they have to keep us safe with good standards and make sure that the public is safe. I appreciate that. But that they also need to be trying to look at ways to look beyond cultural differences, language differences, and recognize when people have got the right stuff, if you like, to be doctors in our province. And I'd like to ask if the minister would just say something about Newfoundland. You mentioned there's a deputies and a dean of medicine's program. I've met people in my community, doctors who were up and leaving for Newfoundland. They were going to Labrador and places like that. There's a 6-month program where they could sign on with a doctor, I think under the supervision of a doctor, work 6 months, and then they have I think my understanding is they're free and clear to work wherever they like under their own steam, as long as they get a rating of approval. And I wonder if the minister's looking at that at all to see. And I mean, I'm glad that the different provinces are now sitting together and talking, because again, maybe their need is greater than ours, but I know from speaking to the member from Yarmouth, he said shortage of doctors is his biggest need. So if you know, other than the ferry, I better say other than the ferry, but we're talking health today. But if you could just have a minute and ask, I'd like to know if you're looking at that at all.
The Honourable Minister of Health and Wellness.
Thank you, and I'm not familiar with exactly what Newfoundland is doing. I will look into seeing what they've been doing over the last couple of years. But I'm confident in the committee that has been put together, especially with Manitoba being the lead or the chair of it, because of course Manitoba, I think, is one of the most successful at immigration, and really over the last, well, I think they've been involved in that for well over 10 years. They've really seen an increase in the immigrant population there. They've been very good at attracting and retaining immigrants to stay in Manitoba. So I know that they have a good track record on it. So I'll try to find out about Newfoundland. Not too sure what they're doing over there. They are much smaller population base than our province, and you know, they I'm sure have some challenges with some remote communities all on their own, One of the things I noticed as minister here when we talk about rural delivery of healthcare, when you get out and see what some of the other barriers other jurisdictions have, Newfoundland is one of those that they have challenges within the health sector. Saskatchewan, Manitoba, those more northern communities where you can only fly in and trying to provide healthcare services. There is quite amazing. So this year, with the additional almost $1 million increase towards the CAP program, last year we had 36 individuals in that program. We're hoping to move that up to 48 this year. Yeah, well, to get into the CAP program, and then of course eventually would take the test. So we had 36. We're hoping this year would be 48. So that's what the additional resources are for, and I'm hoping that we attract those foreign trained physicians that have a good opportunity to pass the exam, and I look forward to filling hopefully all 48 of those positions.
The Honourable Member for Halifax, Clayton Park.
Okay, I know there's just a couple of minutes left. I wonder if the minister later could tell me, and it doesn't have to be now, but who a person would call if I was to direct somebody to call someone in your department to even to get more information about how they might get certified, what else they can do. And so that would be great if I could get a name. And also, if you could give me the name of somebody that could just explain better to me about the CAP program, about the numbers, just the 24 that are currently in it, the 36 you had funded. I just kind of want to reconcile that. And I'm really happy to hear there's an expansion. I want to say that very strongly. One last thing I'd like to just ask the minister about. We won't probably have any time for a big answer, but just to signal to you that this is really important, and that is the culture of drinking and binge drinking. And we haven't talked anything really here about wellness. You're now the Minister of both Health and Wellness, and I have a grave concern about the number of emergency room visits, injuries, sometimes deaths, certainly violence and accidents that occur as a result of a lot of drinking and binge drinking, and a lot of times it impacts young people. I'd just like to raise that and ask, maybe in a minute or two, you could say if there is somebody working on that file in the Department of Wellness, because I think it's got a very negative impact. And even as we speak here today, we know that there have been other social problems that we've been talking about in question period and otherwise, where alcohol plays a factor. But drinking, I'm not at all a teetotaler, but we know that drinking is very damaging if it's done in a binge way or if it's irresponsible. So on a health side, could the minister maybe just take a couple of minutes to answer that? Thank you. 2 minutes.
She has 2 minutes. You can answer as long as you need. The Honourable Minister of Health and Wellness.
Thank you. So we do have a recruiter, Joanne McKinnon, who's a physician recruiter within our department. So we can get you that contact later. But we do have a physician resource, also division within the Department of Health and Wellness. So Joanne McKinnon is our physician recruiter who works extremely hard to find people to get into those areas that we find gaps in, so we can get that to you. Talking about, and thank you for bringing up the wellness side of things, often forgot about, well, not forgot about, but is overshadowed with tertiary care and the other important things that we do within healthcare. That's why earlier this year we brought forward the Thrive strategy, and I know our public health has worked hard over the last little while to have the conversations in the community. Dr. Strang was part, or actually did a report for St. FX around binge drinking, which produced, and studied what was going on down there. Did a report with which gave some policies and recommendations for other universities to look at to see if they would adopt those policies. And I know St. FX has been really out front and center on this, requesting Dr. Strang to come in and evaluate some of the policies they have in place and see how they can improve them. And I believe they adopted almost every single, if not every single, recommendation Dr. Strang had in his report. So I know our time is limited. Maybe we can get back to this. And Oh, okay. All right. We know that it's an area we need to work at. When I was in university, I know that was a concern, not for me, but maybe for some of my friends. But it's always a concern, and we need to make sure that we have strong policies, strong policies in place, and try to have support systems that create a culture that recognizes the dangers of that. We know we've had a recent campaign around mixing pharmaceuticals or prescription drugs and alcohol. Not only as a province have we taken on some of the campaign and media campaign on that, but more on a national level because we know mixing prescription drugs and alcohol can kill you, and young university students need to know that. Not to say that they're all doing it, but we hear time and time again the death of a young student who was a good athlete, who was a good student, who was a good person, who ended up at a party maybe or consumed alcohol and popped a prescription drug that ended their life. And that's so tragic. And I think we all would agree that we need to do whatever we can to ensure that there's awareness campaigns going on and ensure that people are educated in the dangers of that. I know I've scared the heck out of my two kids. I have a daughter who's 14, going to be 15, going into high school, and I've talked to her, and I know they're scared, but I think they're educated, and we have that dialogue. I have a son in grade 6 who I know they're doing some education in junior high. They're doing education in elementary. We need to do more. I know, talking with my colleague, the Minister of Education, they start as low as grade primary, just talking about, pills aren't candy. Don't play with a pill bottle. Something simple like that, so it's in their head, and we need to continue to work on that. We do have a couple of deputies that are looking at the issue of binge drinking within government that are going to make some recommendations to government to see where we can go. I know the new mayor, through his campaign recently in Halifax, this was a topic of the race to become our next mayor, and I know that he's committed to work with partners in law enforcement, the province, our public health officials to see what we can do to increase awareness of the dangers of binge drinking and those areas. So I look forward to our deputies bringing forward some recommendations to myself or anybody in government to see where we can go with that.
The time allotted for the official opposition has elapsed. I'll now recognize the honourable member for Argyle.
Thank you very much, Madam Chair. A pleasure to come back for another hour. And more to the point that the member had just recently brought up. We did have an unfortunate death. I think it was at Acadia. Something pings my brain that there was something at St. Anne's as well. So this continues to happen. It seems like every year there's some other sad story about it. And it's not just universities. It's within our communities that people really just don't know. They think they can do it. They think they can take it and don't understand the signs. And even further that, people around don't understand the symptoms or, what's going on. So just an awareness for everybody to make sure that binge drinking, alcohol consumption doesn't get to the point that takes another unfortunate life. Let's go back to where I left off, and I think we were talking about paramedics, EHS, and all that fun stuff. But the next one on my list, I'm going to get my other list back out here. We go to page 13.8, and here we're talking about addiction and mental health programs. The budget for addiction programs has increased by more than $2.6 million this year. So what does that look like in practical terms? What kind of programs is this going to be funding? And what does this mean for access to the mental health system in Nova Scotia? So 13.8, addiction and mental health service programs.
The Honourable Minister of, thank you. Sorry, I'll give you a minute. The Honourable Minister of Health and Wellness.
Thank you, Madam Speaker, and thank you to the member opposite for asking questions in an area where I think is very positive. We're seeing an increase in support from $6.9 million to $10.3 million. We've had a strong commitment over the last 4 years to improve access to mental health and addiction services. It's something that we have seen the need to do for a long time in opposition. We talked about this. So as soon as we got into government, the former minister knew that we needed to first have kind of a foundation and really a plan and strategy to look at where we needed to go. So we're glad to introduce the province's first mental health and addiction strategy for Nova Scotia. And I think over the last couple of years, we've really seen more awareness put on mental health, not only as a province and as a government, but as communities, as the public has demanded it, I think. And we've seen a lot of support from businesses out there, and I refer to some of the campaigns that are funded, and I don't want to pin one against the other, but the more recent one is Bell. They had a Let's Talk initiative where they've managed to bring forward Olympians who talked about having and dealing with a mental illness. And that's so important to kind of break that stigma of mental illness, break the fact that we just never talked about it because nobody wants to admit or talk about the fact that they or a loved one or a friend is dealing with a mental illness. So we're very glad to bring forward the mental health and addiction strategy. It really gives us a roadmap of where we need to commit funds, where we need to support organizations into the future. And it was, I think, long overdue. So we have seen an increase. Most of the increase is due to the recovery houses moving from community services over under the Department of Health and Wellness, where I've said in this House that I think it is the best fit for that service in Nova Scotia. And I say that because often, many, if not every single individual who gains access or utilizes the services of a recovery house in the province has used health services wherever they live, and I think it's a good fit. So that was a transfer of $1.3 million. As well, we've seen an increase in the funding for the mental health and addiction strategy and standards. And that's a $1,025,000 increase. And also we've seen an increase for community placement programs of $500,000. And there's been also a reclassification of the problem gambling programming for administration, and that's $1,379,000. And these increases are partially offset by transfers from district health authorities, and that was for $460,000. Home care for $250,000, and that pretty much covers that change or that increase. So some of it's dealing with movement, but some of it's investment in other areas of the budget. We're increasing funds towards mental health, and I don't know, maybe we'll get into that in future questions.
Member for Argyle.
Thank you very much, Mr. Chair. Pleasure to see you in the chair there now. It was interesting, the awareness issue was one that that's always difficult. I remember, we had done a bit of an ad campaign on mental health, during my time as minister, and basically trying to find a couple of champions for mental illness, that it's okay to talk about it. It's okay to seek to seek treatment. It's okay to talk about it. And if remember, the individual was I believe a cop, and which we would accord to be a big strong personality that did have problems with it, and so happily spoke to it, talked about the stigma around it, and how going and searching for treatment options was one that truly helped out. And I also remember some time during our time was the frustrating construction of the community living bungalows over at the Nova Scotia hospital site, and the tremendous problems that we were having in trying to find those locations. I know that when I drive by there now, I see them built and constructed, and of course being lived in. And I think those are tremendous steps forward. And I've stood in this House on a number of occasions through a number of estimates and talked about the mental health strategy, and commending the previous minister on that, that it was time for it. And I think our communities are ready for it. And I think the government needs to move forward in bringing it forward. So maybe I'll let the minister speak for a few moments of the mental health strategy, where he sees it going over the next year, and maybe what kind of new programs we can expect, or at least support for programs that are currently in place.
Minister.
Thank you. So first of all, the total budget for the mental health for this year is $140.6 million. And then, of course, the budget for addiction is $42.4 million. So a total of $183 million is in this year's budget for mental health and addiction services. So in that, of course, a lot of funding go to different programs. Of course, the mental health standards that we have in place, and one of the areas that I was glad to make the announcement just recent was the mental health crisis line. That program was offered just here in Halifax. It wasn't 24 hours a day, 7 days a week. It was a limited time. And it was back a number of months ago now. I had the opportunity to announce that we were going to fund that mental health crisis line 24 hours a day, 7 days a week, but also expand it across the province so anybody can gain access to that crisis line. And it's important that, I think people who are finding themselves dealing with a mental illness, that they have an opportunity to reach out. And it could be as simple as making that phone call and talking to someone on the other end about their situation that they're in. Because often it doesn't take a lot to give some support and reassurance to somebody who's having a mental illness episode or a breakdown, or having some kind of issue that they feel they can't deal with. And often as a medic, we would be called to a house with really no description of chief complaint. And you kind of knew, okay, this sounds like it's not a normal call. And often individuals found that was the only way of maybe reaching out for support. So they call 911, they say that they may harm themselves, and of course then that triggers sending an ambulance, often sending a police force, RCMP or town police. And often when we got there, there was no real chief complaint. You can see as soon as you go in and you do your kind of rapid assessment of the scene, and then of course going to the patient, that they're in distress, even though it's not something as easy to figure out what was going on, because I've said this often in the healthcare sector, healthcare field, a lot of things are you recognize the illness or the seriousness of the illness by physical findings. And what I mean by that is, if you're having chest pain, for example, I can feel your pulse or hook you up to an EKG, and you know, I can feel that your pulse is irregular. So that's not normal. It's weak or it's strong, or and then you can say, okay, they're in an area, they're in a position where they need some support. Same as high blood pressure. Yeah, you know, your blood pressure is 220 over 110. That's pretty high. That's something physical I can figure out by taking your blood pressure, and then I know what acuity level you are, and off we go. You're labored breathing. I listen to your lungs. Your lungs are full of fluid. I know that you're ill. You need some treatment. So the healthcare system has always been it's geared around physical finding to figure out how quickly that person needs to progress to the next level of care that they need. So if it means drug treatment, if it means IV treatment, respiratory treatment. But when you're dealing with mental health and mental illness, you don't see that you don't have that physical finding. So it's very challenging. And I've always said how much I respect those healthcare providers who work in the field of mental illness, because it's a challenge to try to figure out exactly where someone is on that kind of acuity level, on what is the next step. Is this person okay to leave at home? Maybe they said they were going to harm themselves and they were just saying that. Very difficult. So I respect immensely anybody who works within the mental health field for the dedication they have to their patients. And it is a difficult job. I really, to this day, I don't know how they can figure out how serious the issue or the episode, mental illness episode they have, and how do you go to the next step. So that's always the challenge. We have dedicated people who are there. So when someone reaches out, we need to make sure that we give them every opportunity to do that in a number of fashions. So I've said calling 911 is one opportunity where you might get a paramedic or a police officer who will engage with that person, and then they'll do a quick assessment. And usually if it's to a point where it's over the skill level of that person, if it's a police officer, they'll call the paramedics. If it's a paramedic and they realize this person is in serious need of support, then they usually transport that patient to the hospital, where you can get some of the psychiatry-trained individuals to deal with that. So allowing for the expansion of the mental health crisis line is important, because especially in those rural communities, if you're having an episode where you're dealing with a mental illness and you're in a rural, remote community, most likely you're not out socializing with people. You're in your own home. You're very private. You're trying to deal with that. We see some recent commercials about that, and some awareness around that. So having a number like this, having access to just a simple number where you could call 24 hours a day and just discuss it with somebody is important. So we have that expansion. Of course, 811 is another avenue that people can kind of call out for support or help, and get a trained nurse online, and they can talk to that person, kind of assess them, and really give them some direction on, yeah, you should maybe see your family physician in the morning, or maybe we should call the ambulance now, or maybe you could get yourself to the hospital ER, where that nurse will call the hospital saying this patient is coming. So there's a number of areas where we've increased funding over the last number of years, and mental health crisis line is one of them. Another area is anti-stigma discrimination initiatives. As I mentioned, we need to make sure that people feel okay. I don't know if, I want to say comfortable, but I don't know if anybody will ever feel comfortable coming forward with their issue, but feel okay that they can discuss it with a friend or community person, a clergyman or someone in their clergy, someone at work, for example. I mean, right now, I think there's some ads, national organizations putting ads in now about someone calling in sick at work. They're working every day, and they leave the message saying, I'm not in today, and then they're at home by themselves. So those campaigns are so important to try to ensure that that stigma is taken away. And I have to say, from the day I stepped into this House, I've always talked about mental illness and calls and experiences I've had, and I know it can get quite loud in here at times when you're debating and answering questions or asking questions, but I know at every single time that I started talking about my experience with people who are having a mental illness or a breakdown, it gets very quiet in here, and everybody is very respectful in the House, and I've appreciated that. Because I think we all realize that we have constituents who call us on a regular basis trying to get the support for an individual, a loved one in our communities. The mental health and addiction strategy, this year we're looking at a strategy forecast of spending of $1.4 million. That includes the school health policy regarding mental health and substance use and gambling. That's the enhanced methadone maintenance treatment. That alone is an investment of $570 million. The prescription drug surveillance in Nova Scotia working group, we're going to provide $90,000 for that. The peer support system, $118,000 we're putting in this year's budget. Municipal alcohol policy. I know we talked earlier from the last member asking questions. That we're putting in $140,000. The youth mental health clinicians for School Plus, we're putting $320,000 in there. I know we've all talked about the fact that if we can get in and get in contact and have those relationships and those connections with young people in our school system early, and picking up early signs of someone dealing with a mental illness, I think the outcomes are much better. It's like any ailment. Early detection, early treatment, better outcomes in the end. Also, a client information system, we're putting $95,000 into that this year. The network model, connecting health care providers, that's the key, because we need to work in collaboration so that people, if it is over their heads, maybe as I would say, over their heads in their training or their ability to support an individual, then they can hopefully know that we have, or they have other individuals who can support them. So I've ran through some of those, but I think it shows that we're committed to it. We're continuing to put funds in to mental health strategy. And I look forward to our partners who are providing support in the community. And it's not all, they're not all asking for government money. A lot of them just want government support or opportunities to showcase some of the good work that's going on in the communities across the province.
Member for Argyle.
Thank you very much, Mr. Chair. And maybe a quick follow-up along with the model of care that went with the detox centers. We've been hearing some issues from, I think it was the Cape Breton one. There's been some discussion around there, especially with its connection with Talbot House. But you know, the change when happened at the Yarmouth Detox, you know, of course there were some concerns from some of the people that were offering the services before, and of course the change went to I believe RN staffing and other staffing. So just wondering what the experience is on that one and how it's going at the detox centers across Nova Scotia. And of course we do need more detox opportunities for people. So just
Minister.
Thank you. So just before I get into that, I just wanted to bring attention to the peer support system to improve workforce credentials. We had a budget last year of $500,000, and we've doubled that this year. So we're going to spend over $1 million just in that component of the strategy alone, because it's so important to ensure that people have the credentials and you know, access to continuing education, for example. The other area where we've seen a significant increase, we've talked about this, is definitely under youth mental health. And the clinicians for the School Plus who can identify problems early. I talked about that earlier. They can treat mild to moderate problems and refer to the formal system if necessary. So again, referring them on to to more highly trained and skilled individuals. Last year, we invested $320,000 in that program. This year, we're increasing that to $1.4 million. So more than doubling, more than tripling the investment in that area, because we know if we can get that early detection and early support, then there's better outcomes. When we're dealing with addictions, that has been an area where you know, each district health authority has addiction services available to Nova Scotians. I've said in the House when we took over recovery houses that the best possibility for someone to get the support and kick an addiction is to have as many options as possible. And often one certain way of trying to deal with an addiction isn't successful. And I know there's stats out there that people who have a reoccurring addiction problem, and if it's not on gambling, it goes to alcohol, or it might go to prescription drugs, it might go to illegal drugs. So addiction services, that's why it's part of our mental health strategy, because we know there's a high percentage of those Nova Scotians who have addictions also have some mental illness, or it's associated with it. So those individuals who have mental illness have a higher percentage of those have addictions too, or have addiction issues. I'm not saying all of them. So it's an important area that we needed to invest in, and we needed to look at the model of care. And I've said this before, we need to make sure we're getting the outcomes we desire with the investment we're putting in healthcare. And if we're not, then we need to kind of look at how do we do things better. So with addiction services, we're putting more money into it. And I recently, well, it was, I think, I'm trying to think when I did my tour of the Valley and the new addiction services. I think it was in the fall, or just prior to our last session. September-ish, where I went down. I met with clinicians who are working within the addiction services along the Valley, and they've changed kind of the model delivery there in that part of the province, which I think is starting to resonate across the province. Because what we had before are like 21-day programs, and they offered a number of them. I believe they offered, if it's 21 or 26, 21-day programs a year. And so if you had an addiction and you were in the Valley and you wanted to gain access to one of these programs, if they were in day 17, you had to wait 4 days before you could get in. Or if they were in day 5, you had to wait more time to get into a program for addiction. And when you have an addiction and someone's calling out for help, tell them to come back in 2 weeks ain't going to do them really well, I think, in their outcome. So they're changing the model down there so that if you come in, no matter what day it is, there's programs running 52 weeks a year now. So that you can come in and gain access to a program. They'll slot you in. You might not be with people who have been in the program for 2 weeks or 3 weeks, but now they have opportunities to get into the program immediately and have the support you need. And during my visit down in the Valley, I can't remember which hospital I was at, I met a nurse who had spent well over 30 years in addiction services. And the nurse, you know, was told to me that she was retiring. I congratulated her and thanked her for all her work. But she says, well, I'm retiring, but I'm coming back part-time. And I said, you're coming back part-time? She says, yes, I'm so excited about the changes that she's seeing in addiction services that she wanted to be a part of it, even though she was retiring. And I think that says a lot about the change in the program, the attitude towards the model of delivery change, and the changes are being positive. And in the Valley, what's interesting, often general practitioners, if you have a patient who has an addiction, very hard to treat that patient. You know, if they come in and they're on drugs or alcohol. So in the Valley now, a general practitioner, if they have a patient, they can refer that patient to the addiction services, where they can come into the program that they have there. They have physicians on staff. They even have the use of a pharmacist who's part of the team, works in one of the pharmacies in the Valley. And what they'll do is they'll try to stabilize that person enough so that they can now request the general practitioner to take that patient back. And usually GPs have been reluctant because, of course, the high caseload that they do have, and it's very challenging to take care of someone who has an addiction. So now those patients can go back, be a patient of that general practitioner. If something happens where they fall off the wagon, as we would say, they can come right back into the program. The physician the general practitioner who's in their physician office knows that that patient's being taken care of, and then they can gain access to the program. So I know that there's been some concerns in Cape Breton around some of the workers who work in addiction services. I've said it in the House, and I'll say it again. I don't want to see anybody losing jobs. But in that case, in Cape Breton, what they've done is they've changed kind of the makeup of who they hired. So they have different skill sets. And that's unfortunate that, that means some people were out of work. It's my understanding through some of the work of the district that some took retirement. And we might have been down to 3 individuals who were looking at other positions within the district, and it's my understanding that they all found work, because I believe there were 6 that were displaced. I think at the original change, 8. Yeah. So from my knowledge that I've gotten, they've all found other areas to work in, and it shows that we need to move forward on making sure that if you have someone come into one of those programs, that you have someone who can provide care for them and really get that person the help they need. So I think I'll end there on that one.
Member for Argyle.
Thank you very much. And I appreciate the answer as well. But we did go through a wholesale change out of staffing at the Yarmouth Detox, and it's kind of the same thing that's happening in Cape Breton right now. I just want to make sure that with the Yarmouth one, there were a number of retirements and people moved, and I think there was a couple people that sort of got left out in the cold a little bit. But for the most part, whether or not the model is better or not, I'm not sure, because the service that was being offered there before was sort of you sort of had some consultants or counselors that sort of had been through it themselves. And I know a couple of them that, they're wondering whether their kind of counsel will be lost in that process. So hopefully, I haven't heard anything bad since the changes happened, but ultimately I hope that it is a better way to do it. Let's switch gears for a little bit. And maybe talk about the health and wellness side, of your portfolio. And I've said before that, I still kind of wish that the office or the Department of Health and Wellness, or the Department of Health Promotion and Protection was still there, because it sort of delineated, where the responsibilities were actually between your 2 departments. Even though I do know that under the health wing, it's separate entity in the way it goes. So maybe just to talk a little bit about physical activity and sport and recreation, just wondering how that programming is going. I see COPS implementation is getting a bit of an increase there. Of course, I see the big drop in the development support recreation sports organizations. So just wondering if we can talk about the importance of the other side of the coin. Many times when we talk about health, truly we're talking about sickness and disease management. When we talk about health, we all of a sudden think that we're trying to make our society better. We're trying to avoid going to the hospital and avoid health. So just wondering, where the mind is for the next year or so on the wellness side, the sports and recreation side of your department. Where are we going with that?
Minister.
Thank you. Yeah, no, even though we did make the decision a couple years ago to bring in what was the health promotion and protection under kind of one umbrella, it was still under health. They still work closely with health, and I think it's a key towards moving forward, ensuring that we create an environment here in the province that allows for people to live a healthier lifestyle or maybe change their lifestyle. And we've talked about this on a national level. Many, if not all, of the ministers of health are the sport and rec ministers, or whatever different jurisdictions call it, because we know the close relationship that needs to happen between what we do under health department and all the divisions and what's done under wellness. And there has to be a connection there, because creating those partnerships are so important. So Thrive, for example, our strategy to try to gear towards getting Nova Scotians, especially our kids, more active and giving them opportunities, is a prime example of how we are utilizing partners to try to succeed in really reducing the need to use the healthcare system. It was one of my first releases, I think, as the new Minister of Health, was to launch the Thrive strategy. And we were down at, I think it was Pier 21 or one of those areas to do that. It was amazing to see the turnout. We had hundreds of people in all different walks of life there congratulating us, for one, but I'm not here to say how good a job we are doing, even though we are. But congratulating the fact that government came forward with an initiative that they see as a way of partnering with government. So Thrive, in my opinion, allows for our government and especially our departments to work together. So I remember we had, I think, 5 seats up on the platform. We had the Premier there, had myself, and we had the Minister of Education. And then as we got closer to the event, most of the front bench wanted to be there, even to the Minister of Transportation and Infrastructure Renewal. Says, well, I want to be part of this. I want to commit my department to be supportive of this strategy. And it just showed, because of course some of the investment transportation infrastructure renewal can do, an active transportation, ensuring that when they're paving the roads of the province, that a lot of the requests is pave a little extra on the side so the cyclists can use it. And so it showed a lot of commitment from our front bench, that they wanted to be part of this, and that they wanted to move forward. And there was a lot of partners, a lot of organizations in the crowd that seen this as an opportunity to partner with the government. And I think I used this example the other day. Government, I think, for a lot of times shied away from promoting any businesses or that if they didn't directly fund something. So if a business wants to go and do an initiative, let them go and do it. If we didn't have involvement in it, then we wouldn't be part of that. But what we asked from the public, from businesses, from organizations, is that we want to be partnered with you, and if we can promote you, we will. So I recently attended an event at the Shannon Park Arena on the base, had the base commander there, the chief of the base, but had a representative from Canadian Tire, and we had a neurosurgeon who was there. And what Canadian Tire wanted to do, they didn't want a speaking engagement, they didn't want to really be recognized that much, but they wanted an avenue to say thank you and give back to organizations that took a good stance on an issue of preventing injuries. And it was on the arenas that chose to have mandatory helmet policy in place. Dalhousie Arena was the first one in the province, and there's a number of them now that have taken that policy and brought it forward. So Canadian Tire wanted to give them 10 arenas across the province, $500. We had arenas from all over Cape Breton, Parsboro area, down the Valleyway, and they're committed to doing it again next year. And all they wanted to do was promote those arenas, and ensure that we can promote the fact that they did this to prevent injuries. So that's why we had the neurosurgeon there, and I was there, and I was glad to do that. And it showed, and I'm very proud to support good corporate citizens of our province who take up initiatives like that. And I had no problem, stating that that they are good corporate citizens when they do things like that. So we have a lot of opportunities to, I think, partner with a lot of people and organizations around Nova Scotia. One of the other areas in Thrive that I'm glad that we're partnering with, and one of our partners is the Aboriginal communities. Along the same lines as the helmets policy, the Premier and I recently were down in Membertou, had a great day skating on their outdoor arena with the chief, and one of the things we were down there for was to support them in their ability to have physical activity coordinators in Membertou and in other First Nations community, so that they could play a role in trying to get their residents more active, more involved, and it was a great event. It was funny to see the Premier was there with his Montreal Canadian jersey on, and Chief Paul was there with his, I'm trying to think of the team he was supporting now. No. Who was he supporting? Anyways, the Blackhawks. And so it was funny. I think one of the pictures in the media showed them there side by side. Now, I did tell the chief that I couldn't support him any longer because he was a Blackhawks fan. But anyways, we had a good day. And the kids were so appreciative. One, of course, they were out of school for the afternoon. But so appreciative of the work that the Membertou has done to encourage an active lifestyle. So some of the funding for physical activity and sport and recreation activities are important, and we're continuing to support them. One of the things is ensuring that there's community-based programs out there so that kids can go and be active after school. And this year we're providing $155,000 for a Learn to Swim program. And I think it's a great opportunity for communities to ensure that kids have exposure to different activities. Not everybody's a hockey player. Some of them can't because of the sheer cost. Hockey is extremely expensive. Swimming is another option for people, and it exposes them to physical activity possibilities. So the physical activity coordinators for the Mi'kmaq community, we were putting in $25,000 each for each community. The other thing also is free facility access program. So, of course, trying to ensure that people can gain access to rinks and pools and other activities and facilities around the province. We have seen a big reduction, and I won't. And I know I answered this in a previous question, and because the member's been very polite in asking. The major reduction is, of course, the BFIT money. It was a program that was supposed to last 10 years, and we had to wind that up last year because there's no money left. It was all accounted for. I'm going to leave it at that. It's a shame that program can't continue because we know the demands in a lot of our communities around the aging infrastructure for recreational facilities. Of course, we took all advantage of the federal government's infrastructure campaign over the last number of years, where they went around spending hundreds and hundreds and hundreds, if not billions of dollars in communities across the country to stimulate the economy. And one of the areas that one of the things we had to do in order for us or for a community organization to get the money it was matched funding. Not all provinces could maximize what they could do, but we did our part, and we knew that if we didn't support some of those programs, that communities would be left out without the infrastructure, I think, that can contribute to a healthier lifestyle. So we spent a lot of money in that program, and the BFIT program was supposed to be there to support those larger projects. So we have a program now under wellness that for facilities and recreational upgrades to trail development, playground equipment, supporting arenas. But one of the things I'm realizing, and we got a list of requests now in, where we have a program that the maximum is $150,000. And I always hate putting a maximum on it, but it seems like whenever people are looking for funding, they always ask for $150,000. We can't fund a lot of those. So the arenas are very expensive for the upkeep and maintenance of those. So when something goes wrong in an arena, it's usually $200,000, $300,000, $400,000. So it's been a challenge over the last couple years not having a program like the BFIT program to go to for those larger capital expenses. Really, the program we have now is really meant to support local community associations who want to do a playground, for example. I have a couple of them, they're asking for $8,000. And trail development. There's an area in my riding, Second Lake Park Association and Friends of First Lake, that have done a number of trail development and upgrades around First Lake and around Second Lake. So they're asking like $15,000, $20,000, $30,000. So really that program that we have now is the best fit for those smaller projects. Where we're struggling is how do we pay for some of these bigger infrastructure asks that the municipality have, that the community groups have, when in the last 4 years we've been struggling trying to get our finances in order, and there's not a heck of a lot of new money. So the program funding has kind of remained constant over the last 4 years. So now not only are we trying to address the community wants for those smaller projects, but now on top of it, all the requests that used to go to the BFIT program now is ending up on the request list for this smaller program. So over the next couple of years, we're going to have to try to figure out how do we address that, and how do we get around those larger capital projects without wiping out all their money in one project. So I was disappointed with the former government. That former Conservative government spent all the money. We don't have any money left in that big program. And that program wound up last year. So I'll leave it at that. And
The member for Argyle.
Thank you very much. And no, I very full aware of the BFIT program, and the uptake was tremendous. If we look at the rinks and recreation facilities that we had across the province that had in our time, prior to our making government, had been neglected by a previous government as well. So, the demand was far higher than we had ever anticipated that the Liberal government had completely shut out and forgot about. So, anyway, I'll leave it there. I'll leave it there, Mr. I hear grumbling behind me, even from the good member for Cape Breton North. But there you go. Public health programs, page 1310. Chronic disease and injury prevention went $3.4 million over budget last year. And I'm just wondering maybe what influenced this, and maybe what additional programs will account for the increase again this year. So again, public health programs, chronic disease injury prevention, $3.4 million over budget. What precipitated that again on page 1310?
Minister?
So, just for clarification on the BFIT program, that program was supposed to run to 2017, and of course we had to wind that up end of the last year. So I'll leave it at that one. So we're going to go now to a public health program. So one of the things, and I know we've talked about this in the realignment and kind of moving the funding and the programs to the right line item. So the change is that it was accounted for in one area that we spent in the other. So if I got this wrong, it's vice versa. It was under community health, and we had the funding come from healthy development, right? We did the spending in community health, but it actually came from healthy development. So we realigned that. So the biggest portion of that was $2.1 million for the healthy eating program funding, and that was reclassified from other areas of public health. So really that takes up the biggest portion. Also, we did the Healthy Communities Program funding reclassification, also from other public health line items. So that was almost $1 million. So right there, over 3.1 million. There was some small ones on Be Active and Safe, Protect Your Noggin, which is a great initiative. One of the first things I actually did, and we provided $200,000 for that program to provide helmets for those kids around the communities who might interact with police officers, firefighters, and paramedics. So very simple program. Paramedic who usually is on shift for 12 hours in a community, especially in rural communities, they know the community. They're usually out and about on a nice day, and if they come across a child who doesn't have a helmet, they can give them a helmet. Police officers, same way. So that was the change in those numbers.
Member for Argyle.
Thank you very much. That explains my next question, which was the $1.5 million from healthy development, but that sort of moves that stuff around. My last, I would call it my prepared questions, revolves in page 1311, provincial programs initiatives, the nursing strategy. And I did remember there was a bit of a discussion one evening here about that nursing strategy, but maybe you can give us a quick rundown of why that's been cut by $5 million. And knowing that I got about 10 minutes left, I'm dangerously asking you to do that. And I got a couple closing comments maybe, because I don't know if we'll get an opportunity to get back up. So, nursing strategy.
Minister?
Okay, so I'll try to be quick. So last year, I say that with a smile. Last year we had $14.2 million. So what we did is we moved out $5 million of that to nursing initiatives. So we transferred that to the Department of Labor and Advanced Education. So we moved grants for nurse practitioners of $150,000. We moved the funding for St. FX nursing seat. That's $2.4 million. CBU nursing seat, $1.7 million, and the Dow nursing seat of $747,000. So a total of about $5 million transferred to labor and advanced education. So that leaves about $9 million. So the $9 million goes towards the nursing strategy. So the nursing program at CBU, we still fund $800,000 to that. Dalhousie, $2.2 million. Yarmouth School of Nursing, $1.296 million. And other expenditures about $13,000. So that's $4.3 million in the total nursing program. Also under the nursing strategy, to make up the remaining $4.6 million, is employment orientation. So long-term care, for example, is $355,000. The employment orientation overall is another $1 million. Continuing education for district health authorities, IWK, VON, and long-term care, that's $1.5 million. And then, of course, the co-op learning for third-year students is $1.1 million. New grads, transition support of $150,000, and other initiatives about $420,000. So that makes up the $9 million, and then the other $5 million that were transferred out. More funding will be transferred to Department of Labour and Advanced Education in future years to better align who utilizes the money and really to better account for where the spending is.
Member for Argyle.
All right, thank you very much. And now that I put that stuff aside, maybe talk about a couple of things that are important to my constituency, some things that I hear on a regular basis when they revolve around health. And maybe I'll thank Linda for doing that. I'm not going to ask any more questions out of the book. And as much as she's got the big book all cross-tabbed and stickered, and she does amazing work, you know that, right? Couple things. The one thing that I hear about the most, of course, is long-term care. So we've talked about that one at length over the last number of bit. I hope over the next number of weeks we'll be hearing that the tender for Nikhil Home for Special Care was successful, that there is somebody that took the tender at the cost that's been offered, and that construction gets there for the 12 beds that are going to be offered there. Number two that I hear about on a regular basis is the availability of doctors. So of course, you know, most of these revolve around people that I speak to, mostly from the Yarmouth constituency, because we've had a number of retirements from that area, but it sort of flows over into my constituency because people just travel to Yarmouth for it. So, you know, if we can continue to focus on recruitment and having options for them, the option that they are revolves into the third piece that I talk about, which are the clinics that we have in Yarmouth and Argyle. That there can be an availability of operating dollars that keep those two clinics open. Understanding the concern of those two clinics, that they're still not working the correct way for the constituents of Argyle. They're okay. We don't want to lose them. But if there's a better way to do it that you guys can help fund to get them there, would be okay. And probably the last thing that I hear about on a regular basis from the constituents in Argyle is the GD emergency room in Yarmouth. I don't know where to start, nor do I know where to finish on that issue. Some people go in there and they're in and out in no time. Other people, and this is from, you know, watching the Facebook feed and the Twitter feed and getting phone calls to the constituency, is the 8-hour waits and the 12-hour waits and all this length of time when it seems that you can go to another emergency room not so far away and get seen pretty immediately. That's the challenge, I think, that Yarmouth emergency room has, is that I can get in my car, drive to Shelburne in 45 minutes, see a doctor, and be home in less time than it would be to sit and wait at the Yarmouth one. In Yarmouth, even when I was minister, we had an operational review done of them, provided them with a number of options on how to speed up the operations of the Yarmouth emergency room. I think out of the recommendations that were provided to them, I think they implemented one. They didn't do any of the other ones because I don't know whether it was people didn't want to do them, don't know what it is, but please, 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 in your capacity as minister, put a little pressure on them to make it a little bit better. I don't know what a little bit better is, but I've been to a number of emergency rooms around the province for one reason or another, and that really doesn't matter why or nor important to this discussion, but you know, you're served with nice people. The nurses are wonderful. The practitioners are wonderful. I know the doctors are great, but the wait times are just bonkers when it comes to the emergency room in Yarmouth. And like I said, it's hit and miss. So those are the things that I hear of on a regular basis at my constituency, and maybe with the last few minutes that we have in this, this hour, maybe you can talk to them. Of course, my question around Nikhil is probably the most important one of those ones. And we've got till 38, I think, to complete this hour.
Minister?
Well, I'll go to Nikhil first because I could talk a little bit on the GP stuff and the importance of all the programs in place and how we address that. So, heard you loud and clear, Nikhil. Home for special care. It's been an issue for a while. I think August 2007, which I believe the member opposite may have been the Minister of Health at the time. So it has been a while, and you know there has been a number of issues around Nikhil, and I think we're at a point now where I think we have a good roadmap forward. The tender for the 12-bed addition is closing Friday, I think, April 26th of this year, and of course once that closes, there'll be an evaluation. And then all expectation is to move forward. So I hope that is some good news to the member opposite. When it comes to general practitioners, I mentioned a number of initiatives that we're doing down in his area where we do have, I know the utilization of the CAP program has worked well down there with those foreign trained doctors coming in. We also have the new residency program in the Valley that will have a complement of 10 come this July or June, I think, of GP residents in that area for the full 2 years. Our hope is they enjoy a rural type of practice. We also fund the physician seat in Sherbrooke for French trained physician, which is important. I know recently I attended an announcement over in Dartmouth where they were able to recruit a French-speaking physician for a practice over there, and I know it's very popular because we want to ensure that people can get access to health care in their first language. And when I was in Ottawa at the French Health Conference, you know, I met a lot of healthcare providers who work down in your area. Very proud to be working in healthcare, but more proud of working in healthcare and providing that service in French. So, but with that, I know time is up for.
Thank you. That concludes the time allotted for the PC caucus to ask questions, and we now go to the Liberal caucus, and I recognize the member for Bedford Birch Cove.
Thank you, Mr. Chair. I just actually have a few questions on a variety of different topics, so I hope the Minister doesn't mind if I jump around a bit. First question I wanted to ask you about was in terms of wait times for people to access the pain clinics in the province, because I am hearing that wait times are considerable. In fact, I heard in January that they can be several years long.
Minister?
Yes, and thank you for that question. I think we all, over the years, any MLA that's been here for some time has been contacted by an individual who might be suffering from chronic pain and trying to gain access to some of the pain clinics that are around. We know that there is some long waits. And it's an area that we need to emphasize some time on, some energy on, to try to alleviate the backlog that we see. Interesting enough, and I won't say who I met with, but I met today and we discussed this specifically on what the future holds and on different treatments and styles of treatment and how do we move forward with that. And it looks very promising. There's a lot of dedicated healthcare providers who are working in the field of pain management, who are offering new, innovative ways to try to deal with someone's pain management And what's interesting about what we discussed today was it's in hope to get people off the narcotics, the inflammatory medication that all have side effects. Anti-inflammatory medication is good, it works for the aches and pains, but when you're on it for a long period of time, there is complications to that. Also, of course, the ramifications of being on a high or on a narcotic, and we know the concern around the addiction qualities of narcotics and having people who are on those drugs and some of the problems that can stem from that. A very hot issue, especially on the federal side, is of course the use of medical marijuana. I don't know where the federal government's going with it. It's no secret that we've been, we've talked about this for many years, and I would think our parties may align a little more than the third party when dealing with the use of medical marijuana. So it's a challenge when the federal government oversees the regulations on that. And the changes that I foresee, which will have an effect on people, because I hear the good stories about the use of it, and it's not for everybody. And what's interesting is I think people have a perception of what they envision someone who might utilize marijuana as a medical use, and it's not that typical stereotypical person. So there's some work that needs to be done there. The future is uncertain in that area with the federal government, but we know we need to do work in the pain management and the wait times of that. We're continuing to work to see what options we have as we move forward. That's one of the reasons I think it's important for us to get back to balance. I've said it a number of times over the last couple of days, because it allows us to look at options and look at what new treatments are out there to support someone who needs support of the healthcare system. And in pain management, we know chronic pain has inflicted a lot of people, especially those who have been injured at work. And I know WCB are utilizing clinics now that are private clinics to try to see if there's some work or some benefits to that. So we're going to move forward, hopefully have an impact on it, and it's a challenged area that we need to try to figure out how do we best address the long waits.
Member for Bedford, Birch Cove.
Thank you. I would urge the minister to examine both the long waits and the medical marijuana issue. I actually had a doctor that I was talking to about the medical marijuana issue say to me, "Oh, I never prescribe that. It involves smoking and that's carcinogenic, right?" And I thought, well, that's easy for us to say because we're able-bodied, but I often think that for people who have chronic pain and or chronic pain on its own or chronic pain and nausea, possibly because of the drugs they're on, medical marijuana can make a big difference. I did want to also talk to the minister a bit about the loss of brain researchers over the last while that we've experienced in this province. We have some extremely highly thought of researchers. I note there was, I believe, a conference on this past weekend, and a Bedford resident actually has discovered, I think it's the part of the body that helps you walk and move, and so we have some significant research going on here. But I have to say, when I see the brain drain, when I see researcher after researcher leaving the province for greener pastures or because of perceived personality conflicts or whatever, that makes me concerned. I was wondering if the minister could speak to that.
Minister?
Thank you. We know, I maybe will disagree on this. I don't think we're seeing a huge out-migration. No question, I think both of us will probably recognize the work that Dr. Mendez has done with the Brain Repair Center here in Nova Scotia. World-renowned, world recognized as one of the best in the world. And I know recently he chose to take on a new role out west, which is a very important job that he's going to take. But the positive thing with having Dr. Mendez set up shop here so many years ago and have the Brain Repair Center here in Nova Scotia is, yes, he may be gone and his expertise is gone, but his legacy is here for Nova Scotians to benefit from. And the work that he's done has been amazing. And I think, you know, because of the sheer work that they do, these neurosurgeons and researchers are, I mean, they're highly intelligent individuals who live to the challenge and live to make sure that when they leave a place that they, I think, leave a legacy. And I know Dr. Mendez has done that. I believe there's been 3 medical neurosurgeon researchers who have left recently for different reasons. But as I stated in my opening, the legacy that is left, the infrastructure that here didn't go with them. Yes, it's a great loss. I've met with Dr. Mendez. I don't know if you've had the opportunity. We had a presentation in caucus with his robot. I can't remember what he called it. That was up in Labrador. And here we are in caucus meeting. He fires up this robot in this Molly. Was it Molly? I think it was Molly. Fires up Molly in this clinic in Labrador, and he has his headset on, his laptop in front of him, and the computer goes down the hallway, and as people are walking by, the nurse is saying, "Oh, hi, Dr. Mendez," just like he was there in real time, and went in to say hi to a patient, and that was some of the advancements in telehealth and telecommunications and the legacy that he's left our province and really the pedestal he put our province on when it comes to research and development. I think it's something that not a lot of Nova Scotians know about. Our capacity to do research here is amazing for a number of reasons. One is the number of degree granting institutes here in our province is a lot. And the proximity of a lot of the medical school and the training to the hospitals that we have in Halifax and being a tertiary care hospital is a good environment for research to happen. So I understand there is some concerns around the recent loss of a number of them, but I think we're in a good environment. We have a good solid foundation to continue on with the legacy that Dr. Mendez and others have left in Nova Scotia, and our capability of doing the research, I think, is positive. We have a good mix of population. It's small. A lot of research doesn't need to have a huge population base like the Torontos or the Montreal. Some research does, but a lot of it just has to do with having a good control on a smaller population that you can do good research in. And I've promoted this before, you know, and it's not just in the field of neuroscience that we do research and we have pilot projects and we do testing. Paramedics, for example, have contributed a lot over the last number of years on different apparatuses on the truck, different programs, and I look to the clot-busting drug for someone who's having a heart attack. Paramedics in Cape Breton, for example, were utilized a number of years ago to test the possibility of them delivering clot-busting drugs in the house, in the back of the ambulance when someone's having a heart attack. The pilot went really well, very successful, to the point where we made the announcement last year, maybe a year and a half ago, that that will be available on all ambulances, as long as there's an advanced care paramedic there, and access to that. So if you're having a heart attack and you're a primary care paramedic, you could call one of the other advanced trucks in nearby, or even meet up with them on the highway and have that clot-busting drug delivered. So I think we're in a good position in the province. Yes, I was concerned that a couple of them have left, but I feel that we have a strong foundation for research and development here in the province that will continue to have success in the future.
Member for Bedford, Birch Cove.
Thank you, Minister, for that, and I just hope we don't see any more leave, because I think there's been enough go. Not surprisingly, my last set of questions will be around the issue of Lyme disease. I'm wondering if we have any new numbers, because the last numbers that I was given a year ago were for 2011, so I'm looking for the 2012 numbers. And also wondering if there have been any new areas that are being announced as being endemic for Lyme disease bearing black-legged ticks.
Minister?
Thank you. We were anticipating that question. We had the go figure. No, I know the member has been involved with a lot of organizations and individuals concerned about Lyme disease, and I know the region in her riding where there was a high level of ticks and individuals who contracted Lyme disease. So I know it comes from personal experience with constituents of yours, and you know, it's important as we move forward that you know, we have good responses. You know, prevention is the key. And I believe over the last number of years, we worked in the member's opposite area of her constituent with some baiting stations, I think they're called, with the medication that tries to, and I think it's a study, I believe it may be still going on. It's a partnership with the federal government, I believe, because they oversee, I think, the chemical they're using in it. I remember the former minister, I think, had to sign off on the use of it. So I'm not too sure right now where that one is or what's involved in it. So we continue to monitor the areas for black-legged ticks. We currently have 6 known areas that include Queens County, Yarmouth County, Shelburne County, Lunenburg County, Halifax County, and Pictou County. So on our website, we do show some areas in the province that you know, we're concerned that people should take extra precautions. I want to ensure that people should take precautions anywhere in the woods if they're out hiking or hunting or fishing or just out and about in our woods, because we do have ticks, and you want to prevent that. So on our website we do have areas. There was a recent added area in Queens County, and that would have happened in October. We did a news release on that. There was alerts sent out to the district health authorities. It's on our website, and it's around the, my eyes are good, but this is very small print, around the Liverpool area, I believe, and Moose Hill and Great Hill and Milton area. So if you go on the website, you can see, and I can table that site. It shows some of the more concerned areas. But the message from public health and our public health officials is that we want all Nova Scotians to take precautions when they're out in the woods to prevent you know, any ticks from landing on them. We do have a statement for managing Lyme disease in Nova Scotia. It's a document developed by the Infection Disease Expert Group, which is on our website. I encourage anybody to go to the website and they can read and learn a little bit more on it. One of the other things we're trying to do is work as a department with Doctors Nova Scotia and partner with them to make sure that their membership have access to the produced articles about Lyme disease in their monthly newsletters, right? Because, I mean, we want to ensure that as many physicians as possible are aware and keep educated on changes for any ailment, including Lyme disease. So I think I'll leave it at that. I think you may explore this a little more, and I'll allow for more questions.
Member for Bedford Birch Cove.
So am I to understand from your answer that we don't have the numbers of infections from last year?
Minister?
I can't find it right in front of me right now. We're of course trying to see if we can produce that. And if we can, I'll give it. I've been very active. Even I know estimates will end tonight. If we can find that information, I'll get to the member as soon as I can.
Member for Bedford Birch Cove.
Yes, and the question period will begin tomorrow. So I did want to sort of make a little bit of a plea here, Minister, in terms of prevention. One of my hobby horses has been that we need to have more education for people. People need to know about Lyme disease. They need to know the symptoms. They need to know what they can do to protect themselves. And so last year, what I thought was an excellent ad came out early in the spring. I haven't seen that yet this year. And I'm wondering if you could speak to what kind of educational efforts are going to take place this year. I was happy to see that ad come out, but I have to say I was pretty disappointed that that's all there was. There were no, with all the advertising going on in this province, I was surprised to see that none of it was focused on Lyme disease and just letting people know. I mean, a lot of us like to go out and to hunt and camp and fish and kayak and all of that, and we're tromping through the woods. And I do worry about people who think, I don't live in Bedford or Queens or whatever the endemic area is, and they think that they're protected. And I don't think that's the case, and I think we need to be doing a better job of alerting people to that.
Minister, you have about 30 seconds or less.
Okay, I would agree. So we'll do what we can to try to bring more awareness around it. And in 2012, we had 50 human cases of confirmed Lyme disease were reported in the province.
Order, please. Order. We have now reached the moment of interruption. Committee will now rise and report its business to the House.